Hello everyone, I am BIDHYA SHRESTHA, third year BPT student, currently studying in Netaji College of Physiotherapy, Mangalore. In this video, I am going to discuss about carpal tunnel syndrome and how we can treat carpal tunnel syndrome both clinically and with the help of physiotherapy. So, what is carpal tunnel syndrome? The tingling and numbness sensation due to the compression of the median nerve in the carpal tunnel of the wrist is known as carpal tunnel syndrome. Talking about the anatomy of the carpal tunnel, the floor of the carpal tunnel is formed by the carpal bones. The roof is formed by transverse carpal ligament and 9 tendons, and the median nerve passes through the carpal tunnel. After passing through the tunnel, the median nerve supplies the thumb, the index finger, the middle finger and the lateral half of the ring finger. So any kind of abnormal sensation in these areas which is caused due to the compression of the median nerve is known as carpal tunnel syndrome. It might be due to the inflammation of any nearby tissues or tendons, repetitive activity like typing, painting, writing, joint arthritis, diabetic neuropathy, fracture of the carpal bone or any kind of abnormal bone growth. Initially, the symptom shows a tingling and numbness sensation in the area supplied by the median nerve and pain which is mainly during at the night. As the condition progresses, there will be constant tingling and numbness, swelling, and there will be wasting of the thenar muscles. And there will be difficulty in the gripping and activities like holding the small objects, buttoning up the shirt, and turning the keys. The major thing here is analysis of the symptoms properly, measurement of the thenar muscle bulkiness, and there are some special tests which we can perform. The first one is the Phalans Test. In this, we will bring our soldiers in abduction, bring the elbow to the shoulder label and flex our wrist like this. If the patient complains that his abnormal sensation has been reproduced, then the test is positive for carpal tunnel syndrome. The second test is tunnel sign, in which we will take the patient's hand and tap the carpal tunnel area like this. And if the patient complains that his symptoms has been reproduced, then the test is positive. Third test is Phalans Test. In this test, we will hold the patient's hand like this, keep our thumb in the thenar and the hypothenar aspect, and then compress the carpal tunnel area like this. And if the patient complains any kind of abnormal sensation, then the test is positive for carpal tunnel syndrome. Clinically, we can treat carpal tunnel syndrome with the help of icing, non-steroidal anti-inflammatory drugs, local corticoid injection, corticosteroids, and use of the wrist braces and splints, mainly during the night. Now, I will discuss about the role of physiotherapy in treating carpal tunnel syndrome. For the pain relief, we can use the modalities like ultrasound and TENS. And there are some very easy home exercises which have been proven to be very beneficial for treating carpal tunnel syndrome. Moving on to the exercises, the first exercise is wrist flexion and extension. For this, we will make a fist and move our wrist upwards and downwards. We can do this exercise for 10 to 20 times. The second exercise is radial and ulnar deviation. For this also, we will make a fist and move our wrist sideways like this. This also we can do for 10 to 20 times. The next exercise is finger opposition. For this, we will touch the tip of each finger with the tip of our thumb like this. And we can repeat this activity for as many times as we can. The next very easy exercise is rubber band exercise. For this, we just require a rubber band. We will wrap this rubber band around in these 4 fingers and do this. We can perform this exercise as many times as we can and has been proven to be very effective. The next exercise is ball squeezing. For this, we can take any soft ball like this and then squeeze it with the help of all fingers. This exercise will help in strengthening the muscles. Keep it between the thumb and the fingers like this and squeeze it. 10 times you can do this exercise. Keep it between the thumb and the finger and then again squeeze like this. The next very effective way to release the tightness in the carpal tunnel is we can keep a soft ball over a surface and then roll it over the carpal tunnel area like this. We can do this 15 times. The next exercise is wrist flexor and extensor stretch. For this, we will keep our hands stretched, bring the palm downwards, and with the other hand we will pull the palm towards you. We can get a slight stretch over this area and we can hold this position for 10 seconds and repeat for 3 times. The next is the extensor stretch. For this, we will keep our hands straight, bring the palm towards you, that is upwards and frontwards, and with the other hand we will again pull the palm towards you. We will get the stretch over this area and we can repeat this for 3 times, holding for 10 seconds. The next one is the thinner stretch. For this, we will keep our hands like this. With the other hand, we will hold the thumb and pull it backwards. We will get a stretch over this area. This is the most effective stretch to release the carpal tunnel. We can hold this position for 10 seconds and repeat for 3 times. Next one is the nerve gliding exercises. For this, we will bring our affected hand in a straight position, then extend your wrist and fingers. This will create a stretch in the median nerve. For the nerve gliding, if we are moving our wrist downwards, then we have to move our head to the same side. And if we are bringing our wrist upwards, move your head to the opposite side. Like this. This creates the gliding of the nerve. We can hold this position for 3 to 4 seconds and repeat this exercise for 10 times. Next one is the tendon gliding exercises. This exercise we will perform in 5 stages. We will keep our hands like this. This is known as arrow, then claw, tabletop, half fist, and then full fist. Once again, arrow, claw, tabletop, half fist, and full fist. This exercise has been proven very effective to treat carpal tunnel syndrome. Thank you so much for listening. I hope this video has been helpful to you all. If you liked the video, then please let me know in the comment section below. We'll try to make more informative videos in the coming days. Thank you.